Health is an important part of everyone's life, and good health determines how productive a person can be and how much they can participate in daily activities. However, getting access to quality healthcare is a major factor to staying healthy. In Nigeria, some of the challenges affecting healthcare delivery are poor and inadequate infrastructure, obsolete and dilapidating medical equipment, poor and inadequate distribution of health workers, poor quality of healthcare services, lack of essential drug supply, amongst others. The collapse of primary healthcare centers nationwide has also contributed to the worsening situation of healthcare delivery in the country. Well, joining us via Zoom to discuss more on this is Chairman, Save a Life Group, owners of Save a Life Mission Hospitals, Save a Life Tech Hub Limited, and Save a Life Communications Limited, Dr. Richard Okoye. Good morning. Thank you for joining us.
Thank you, and my pleasure, and thank you for having me.
You're welcome. Now, there are those who say that if you do not know where you're going, you should know where you're coming from at least. And so let's begin with the matter of how we got to this point, where reports are saying it is only about 25% or even less of the primary health care across the country that is functional.
Yeah, basically, the situation in healthcare sector in Nigeria right now is quite, it's kind of being in a deplorable state. But fundamentally, for addressing such issue, you have to first of all understand what has actually brought us to this particular point. We must understand, as you people have actually emphasized so much on that, on the issue of Japa syndrome. Of course, fortunate to mention that in most of the communities in Nigeria today, you will hardly see any doctor. So the fate of those ones actually hanging on a balance. In the same accord also, we have this misconception as well. When we are talking about healthcare, we are looking at infrastructure. So most times you see government, you see agencies build a structure and say we've just built a hospital. Hospital is much more than infrastructure. It's much more than equipping. Otherwise, the best hospital ever built has to do with the issue of a born specialist hospital built by the current Senate President, Senator Fabio. But very unfortunate that if we get through almost of our teaching hospital, we see a lot of latest equipment that can testify to that. But majority of them have been abandoned simply because most of the times when we want to do a hospital building and equipment, we put it from the contractual kind of engagement in terms of acquisition, whereby you give a contract to somebody, import equipment, not considering the person who's going to use this very equipment. A doctor that may even have trained on the use of, maybe look at the Cadillac, for instance, for this heart. He may have trained with a Philip equipment wherever. And the government will give a contract without minding or taking the opinion, those that will handle this equipment, what are they used to? So most times we find that we bring those equipment, commission, the first person that will touch the instrument will get it damaged and repair become and also service thereafter. But the worst that is actually happening right now, we admit that the primary healthcare has totally collapsed. But the one that is more destructive, as it were, is allowing healthcare to go under Band A implementation. I can talk to you today, many hospitals have shut down on the basis of that. Some are thinking of alternative power supply, which obviously will make most of those hospitals not being able to sterilize the equipment nicely. And of course, if you leave a particular place with a particular temperature, more organisms will grow. And so we have now, as another challenge coming up, nosocomial infections. Infection coming in from issue that has to do with hospital acquired. Because if you allow those organisms, over time they undergo mutation, become resistant to the existing antibiotics, and it's going to be a disaster. In my hospital, a couple of weeks ago, or 2 weeks ago, I was given a bill of 43.9 million in the name of Band A. And while we even paid 8.5 million naira and pleaded, we said, so look at the end of the month, let us pay salary for the people that will even generate this money. That landed on a deaf ear, and they came and cut off the light from the hospital. We bought diesel, that unfortunately it was a bad one also, that shut down the generator. It was a commotion that we have to discharge our preterm babies. Those that just did kidney transplant, we are in a terrible state. So that's why when you look at quality, I think it is something we may reserve for now, but to be able to address these fundamentals. There are 3 tiers of healthcare. You have the primary, you have the secondary, and you have the tertiary. Collapse of primary and secondary healthcare now in the country has put pressure on tertiary institutions, which otherwise should be dealing with multi-specialty discipline. But today you get to teaching hospitals that are treating on cough and catarrh, they are treating diarrhea. These are not what is actually designed to be. So it is a very unfortunate situation we have been able to come to. And as a matter of as quick as possible, if something technology will aid, we have to take action before it becomes too late.
Absolutely.